All right. This is Patty Uplinger, and I am introducing our speaker today, Kris McCann. She's the Executive Director of Bay Area Housing Corporation. And take it from here, Kris. I know you're going to want to share your screen too, so I think Sonia can help with that.
I will. Well, good morning, everybody. First of all, I'm a mom. I have a daughter that has cerebral palsy, and that was the original reason that I got interested and involved in this. I've done housing, I've done advocacy, I've started 2 or 3 housing nonprofit organizations. I've been around the block as far as doing things. So when Patty called me, she first asked about the work that I had been doing around people with intellectual developmental disabilities that may also have dementia or Alzheimer's. And I'll tell you a little bit of a story of how I got involved in this. I'm not an expert, so I'll just do a huge disclaimer before we even begin. But I had family members come to us at Bay Area Housing Corporation and say, there's a huge need. And we also got David Grady of State Council, who served on our team with us, involved in helping to create information that went to our regional center. I served San Andreas Regional Center in Santa Clara County, San Benito, Monterey, Santa Cruz County. And then I also work with Golden Gate Regional Center, which are the counties in the greater, the most expensive areas probably in the entire state is who I work with. So what we did, we're involved in helping to create information that went to the regional centers that hopefully would advocate for specialized housing for this population. And then COVID hit. And so everything has sort of been put a little bit on the back burner. And I hope as time and COVID sort of is a situation that is more, we have a handle on, that we can proceed. So I'm going to share with you some of the research that I've done, we've done. We formed a team primarily from Bay Area Housing Corporation, from families that have children that have Down syndrome specifically, as well as we had a member on our group. Her name is Paula Gann, and Paula was appointed by it was the Governor's Council on Alzheimer's, and she represented people that have children that have intellectual developmental disabilities. She has a daughter that has IDD as well as the early stages of Alzheimer's. So we got a lot of good information, and stop me as we go along. How many of you are knowledgeable, would you call yourself knowledgeable when it comes to people that have IDD and having dementia and Alzheimer's? Good, good. Steve, what do you know?
Yeah, we definitely have to turn around and provide more services for people who have early dementia. We more or less have just done stuff with, children and with adults. We don't really have that many residential care homes that can focus and specialize in people with dementia.
Yep. And Sonia, you also said that. You raised your hand.
Yeah, what I know is that they tend to experience some other symptoms of dementia at an earlier age than we generally expect. And
absolutely,
folks with developmental disabilities are living longer and healthier, so we're seeing it more, possibly outside just certain diagnoses. But yeah, it's an issue. People are living longer. There's not a lot of residential options, and people need to learn about what's happening and not just think it's bad behaviors or other things, and just understand more what's happening.
Absolutely, absolutely. And realize how many of our family members are living with their family members
Right.
who are also going to experience dementia and Alzheimer's and potential of that. So it's not just our clients, it's also a lot of the caregivers,
Yeah.
which are a lot of the family members who, so it's a huge issue, and it's going to get, I think it's going to be increasing. So let me share my screen. If you could, anybody else have any direct input or direct relationship with the whole thing?
The only thing that I could add, I guess, would be that we have had some suspicions that we may be supporting someone who has early onset of dementia, and so working collaboratively with the psychiatrist who's prescribing psychiatric medications for a psychiatric diagnosis, and then also trying to coordinate with primary care for more testing has been an interesting and unique challenge for us.
Do you have in your community any support groups or any families that are specifically around the having a diagnosis of Alzheimer's or dementia or IDD? Are there any groups that are currently out there working?
We have all sorts of different psychosocial rehab sorts of groups, but none of them focus on Alzheimer's or dementia. We do have coping skills groups related to various mental health diagnoses and that sort of thing, but have yet to find a support group that fits our unique population for client or family related to the Alzheimer's or dementia.
One of the things that I thought was absolutely amazing is we were trying to figure out even the numbers, statistics of how many people have Down syndrome as their primary, why they're involved in the regional center. It is very tough. And Sonia, you will probably find this, and you can agree or disagree, to get the numbers of how many people, because that's not a specific area that is checked off of how many people there really are. So we had to go through a huge amount of research of going to DDS and all over to find out in the greater Bay Area, we at least have 1,000 individuals that have a diagnosis of Down syndrome. And that doesn't sound like very many, but let me tell you, for those 1,000 families, it is a lot, and what kind of support they get. So what I'm going to do is hopefully pique your interest in wanting to know more. And for families that need support, let me tell you, I think this is a beginning issue, not an end issue. So let me share my screen if it's possible.
You should be able to. There you go.
Great. And I'm going to move this. No, we don't want to do that. Hold on. All right. So I am the executive director of Bay Area Housing Corporation. And if you recall, I'll tell you just a little context. I was involved with an organization called Housing Choices Coalition. And Housing Choices, we were a fairly, I think, how many years ago was this? So I was very involved in creating some of the first set-asides. We were on the West Campus of Agnews. We did a project there of 215 units of affordable housing. So I've been involved in creating a variety of different housing options for people with intellectual developmental disabilities. I was also involved in the original closing of Agnews Developmental Center and writing the housing plan that brought in 2 other housing groups. It would have been West Bay, which was the Golden Gate area, as well as East Bay, which was the housing consortium of the East Bay. So I've been involved in helping to create different housing models based on different clientele. If some of you don't know the 962s, that was an original piece of legislation that we got through that created housing for people in the community that had individuals that were medically fragile. So out of our homes right now, we own 48 homes for people with intellectual developmental disabilities, and we do the property management of it. And I've been lucky enough to be involved in helping to create each and every one of them, and very proud of that. We also have homes that are what we call specialized residential homes, and these are for people that have some behavior challenges. And remember, we own the homes, we provide the property management. The regional center selects the clients that go into the homes, and then also selects who the provider is. So we're just basically the housing part of this. So what I am trying to do is to try to inspire, hopefully DDS, hopefully, and back to state council, they were very supportive of this, of getting more resources for these families, and both in the homes for services as well as housing. So I can develop housing, but if we don't have programs that go along to support the individuals with the housing, it doesn't work. So does that make sense as far as just the beginning of it? Okay. So what I'm going to do, I'm telling you a little bit about my background, the housing organizations I've been involved in, specialized housing, and we're going to get into IDD, dementia, and overview of the need. Have any of you experienced a family member that may have dementia or Alzheimer's in your regular family? Anybody aware, or because it's a huge issue, not just for people with IDD by any means. It is a huge issue out there. So I can't see everybody's stuff if there are, but I'm going to move on. So I love this picture. It is not enough to understand or to see clearly. The future will be shaped in the arena of human activity by those willing to commit their minds and their bodies to the task. And that's what you guys are. I mean, you're the catalyst, you're the advocates, you are the people that really push forward possibilities and make them known out there. And I just love that. This is another one that sort of breaks my heart. And the statue is called Emptiness and was created by a grieving parent. It is a great attempt at describing how a parent feels after losing a child. The aging caregiver of a person served with IDD living with dementia will experience great pain and suffering. Our commitment, I'm trying to move my screen around so I can get half of my screen I can't see because of us. Let me see, how can I move us? Maybe I can move us on the side. No? Oh, well. Our commitment is to support their long journey ahead. And I just thought, for those of you not able to see the screen, I just think that is a very profound one. So we really want to help families as much as possible. So who are the people with IDD in California? And I think you know these statistics, but since you can't see the screen, again, we're looking at 629,000 statewide, according to the state or federal definition. 80% of the individuals, and I think you know that, are living in the family home. Patty, is that about true up in the Sacramento area?
Yes.
Yeah.
I believe so.
Yeah. And then,
yeah. Sonia agrees. Yeah.
Okay, super. And there's about 84,600 individuals in California with intellectual and developmental disabilities, age 32 and older, who are served by the state's system of regional centers. So 32 and above. Aging adults with developmental disabilities represents the group at highest risk for losing secure, affordable housing. I think you all know that, that is a very vulnerable time. 55,000 of them live in family homes with aging or aged parents. And remember when I talked about, it's not only for the individuals that may have dementia or Alzheimer's. It's also for the family and the aging parents that are also experiencing. During the past decades, this population has grown 4 times faster than the general population. Adults with IDD live on average monthly, you know this, of $889, which is about $10,668. Now that goes a little further, maybe up in the Sacramento, or it used to. You guys are definitely coming up there also. But when you look at the average home that we're buying, when we're out there buying homes for our population, guess how much they are? The average.
700,000,
Nope.
800?
Nope.
$1 million.
Keep going. $1.1 million, $1.2 million. If I can find a property under $1.1 million, I'm doing great. To be able to find 3 bedrooms or 4 bedrooms. And what we're even, and you can't even find it in the Bay Area. Now we're going further south. We have properties down in Hollister. Further south, we are moving further and further south because the average homes of what we're purchasing, the prices have gone up so much. And remember, this is only for the individuals that have had a referral that's coming from the regional center that literally is falling into categories. Patty, you were going to say something.
How does that figure? It's 1.1 million. What's that compared to, Kris, when you started getting houses for Agnew's project?
They were about 800,
Okay.
800,000, 900,000. And that would have been 15 years ago. So that's how much the prices have gone up from when we started 15 years ago looking for properties. And we can't even touch our homes right now. And remember too, when we buy a home, we adapt the home to meet the needs of the families or of the clients. And that's usually another $300,000, $400,000. So the good news is that money is coming literally from grants we're getting from DDS. But what happens to all of the other people out there that are needing housing? So I feel in many ways, I've been working a long time to put the thumb in the dike, but there is a lot of need out there, and you guys know that. And I don't need to tell you what the need is for housing. It's huge. It is huge. I'm gonna some of this stuff I'm just gonna go over. And
excuse me, Christina,
yes.
This is Steve Andrews.
Yeah.
Can you make sure that, and Patty, you might be able to help her out, that she emails us this information so I could put it with the minutes for our meeting?
Sure.
Great, thank you.
Sure, no problem. So the question is, what is a developmental disability? You all know that. Autism. We also know that the rise in autism has been huge. The numbers are growing. It grew by 41% between January 1st, 2007 and 2017. Caseloads we know, and we just saw the governor's budget. So the need is greater. The dollars, at least we didn't go down this year, but it is large. I'm just going to pick some of these things to go over because there's a lot I can do. So when the families came to us and basically said that there was a need, we came up with a vision of what we would like to see for people that have children with and children that have IDD and dementia or Alzheimer's. And it is all caregivers, family members, friends, and IDD direct care workers will have knowledge, skills, and empathy to work with persons served with IDD living with dementia to provide exceptional quality, culturally competent, person-centered dementia care. So that's our vision. That's what we would really like to see happen. What we are finding out there, and this is how our purpose of what we were trying to do, is to improve lifelong specialized person, family-centered health services and community resources to enhance the quality of life for persons served with lifelong intellectuals and developmental disabilities such as Down syndrome, who have Alzheimer's disease or related dementia. Let me go through some of this. How many of you are super familiar? I mean, let me hit what the definition is of dementia first. This is an amazing statistic. Look at this. 100% of persons served with Down syndrome will display a neuropathology of Alzheimer's disease at 40 years of age. 100%. I had no idea. About 4 years ago, I was asked to be by DDS to be part of a, what was it called? Talk about memory here. It was, what are the significant issues that are affecting DDS and our clientele as time goes on? And one of the issues that was identified, and Nancy Bargman said it, was the issue of Alzheimer's when it came to people that have Down syndrome as an emerging issue. And it was the safety net. It was a safety net committee and giving input to that. And that's the first time I had ever heard that. I had no idea that Alzheimer's and people that have Down syndrome, that basically that is on the same exact chromosome where that lies, which I thought was pretty amazing. I had no idea. And doing more research on it, here's a very interesting thing. People with Down syndrome almost always develop Alzheimer's disease as they age. In addition, because Alzheimer's disease primarily affects older adults, the population with younger onset Alzheimer's disease faces unique challenges with diagnosis, care, and stigma. Health and Human Services will undertake the actions below to better understand the unique challenges faced by these groups. So it was doing a lot of research, and I went down to San Diego and visited an amazing program down there, traveled to New York City to find out a program that is going on there, and gathered some amazing information of different programs that are taking place. Let me also throw this out. There's different types, in case you don't know, of dementia. One is Alzheimer's disease, and that's memory, visual, spatial, language disturbances, indifference, delusions, agitation, behavior challenges. What usually happens, and for those of you that are caregivers out there, when people start to change maybe some of their behaviors, what is the first thing that sometimes happens as far as the behavior challenges start to happen in an individual? Can somebody say that? Somebody on there that's works with clients. I know there was somebody there. Well, they usually would be evaluated perhaps by a therapist or by somebody, and sometimes they're given drugs, more and more drugs. And the thing that you need to understand is that if somebody has Alzheimer's and they're given certain types of drugs without really having a baseline of who they are and what they're doing, that could be lethal. So I'm just throwing out, there is a lot of information to know, and not enough people know about that correlation between what somebody might be experiencing. Lewy body is another type of dementia, and that's where hallucinations can take place. Vascular dementia, abrupt onset of deterioration, and then frontotemporal. And this goes much more into the details of it, where we're probably is much more in the Alzheimer's disease as far as being an area. I also wanted to throw this out. Persons served with Down syndrome. Among persons served with intellectual developmental disabilities, factors favoring more rapid decline include age, greater burden on psychotic symptoms, gait deterioration, presence of Down syndrome. Persons served with Down syndrome are at higher risk of dementia and show a significant elevated prevalence with advanced age. Among persons served with Down syndrome, early onset and often a more rapid progression of cognitive function are evident. And I just, and we're saying, this is an amazing, look at this. The unintended problem, the consequences of good care, life expectancy of persons served with Down syndrome. In 1930, the average year of death for somebody that had Down syndrome was 9 years of age. In 1947, 15, 1982, 36, 1991, 58, 2000, 58, living a much, much longer. But as people are living longer, the condition of Alzheimer's begins earlier. And usually, if they do not qualify for sometimes getting into nursing homes for their condition because they're too young. They're too young. And that's where that whole issue of getting some specialized housing coming on that would bring people together to be served. So not only do they have an intellectual developmental disabilities, they may also have some memory challenges. How long, when somebody's in pure Alzheimer's, how long do you think they normally live? Does anybody have an idea?
4 or 5 years.
Yeah, exactly, exactly. It's a mean disease. It is a mean disease, and it happens beginning at the frontal lobe and moving back. So one of the first things is taste, sound, hearing, all of that, and vision. And sometimes that is seen as something else. And Paula, my friend who has a daughter that was diagnosed, it took forever to get a diagnosis. And it's like many things, if you don't know what you're dealing with, it's much, much more difficult. I want to show one other thing. The figure below summarizes the age-related prevalence rates of dementia in persons served with Down syndrome, those with intellectual developmental disabilities with Down syndrome, and the general population. Alzheimer's disease is more common with IDD. If you look at this dotted line here, it begins around 30, 40, and then it goes up. The general population begins right around 55, 60 range and moves up. People with intellectual developmental disabilities more in that 50 range as well. But you can see it begins much, much earlier. And how many caregivers, providers do not understand what to be doing with the situation. And there's really not much information out there of training caregivers, training, and how do you adapt homes to make it better for the person to be able to live, and falls. Oh, I'm going to show one other thing here. So, listening to listening for over 30 years to the person served with IDD living with dementia, carers, family members, and their friends, and BAHC staff, we have heard the enormous impact of providing dementia care on carers, families, and BAHC staff versus the limited capacity of health and community care services to respond to the needs. The additional impact of behavioral and psychological symptoms of dementia in reducing care choices, the lack of and delay in diagnosis, that's just what I was saying, resulting in missed opportunities to plan ahead for care requirements and subsequent late presentation to IDD dementia services, overwhelming demand on the existing IDD workforce, geographic variability in persons served with IDD living in dementia, having access to services, poor experiences for people served with IDD living in hospitals, multi-purposes areas. And what I'm going to do is to share with you some of the things that can be done. Behavior changes and decline in functioning ways need to be considered within the context of the physical environment. Now, this group is primarily, Patty, around housing. Is this primarily housing
No,
or just
No, I'm just the
all?
housing guru.
You're just the housing person. So I'm going to give you sort of the overview, but I want you to see things that can be done for individuals that have some decline and what can make their living environment better. And then also how to hopefully get more people that are knowledgeable about this. Behavioral changes and decline in functioning always need to be considered within the context of the physical environment. Physical environment can be a barrier to functioning. Rule out problems with physical environment as a cause or decline of behavior challenges. Let me throw out here. This is a program that took place in Florida. And it was a home that was specifically created for people that had Down syndrome, as well as were experiencing dementia. So sometimes people that are experiencing dementia or Alzheimer's start to withdraw because maybe they can't see as well, they can't hear as well, and they don't want to go to their day programs anymore. And so what this program did is to remove the burden from aging caregivers to travel in the community while fully engaging persons served. So they created cool day services at their program that were fun for the clients to do. And I just thought this was such a cool idea because they sometimes did not. Now with COVID, nobody's going out and necessarily getting their nails done anymore. But I thought programs that would focus on serving them in their living environment was such a cool thing. Also, special dentistry and audiology, because as I said, hearing is one of the first areas to sometimes go, and to be able to do it for the individuals there. Create living environments that were smaller, quiet, well lit, intimate setting to converse and listen to the music. Outdoor area. Person served with IDD living with dementia enjoys swimming and relaxing. Water tends to be a very important thing. And sometimes there's a lot of wandering. So you need to have an area that the individual can wander or to walk, because sometimes there's frustration in there. But you want an area that people can go to and have a good program that would be there. Physical activity, daily activities to get and create circulation and to reduce falls, because that's an area that tends to go. I thought this was amazing too. Hydration is the #1 issue for proper metabolization of medications, reduce urinary tract infection, and to create smoothie bars. And all I'm trying to get across to you is that there needs to be a way of having more people understand what the issues are and getting more people to services that people understand that there are programs or need to be more programs out there. Even when you're designing homes, this is a caregiver, a group home for help as a son is scheduled for a 20-day psychiatric hospitalization due to property destruction. He had Lewy body dementia, and he did not recognize what he looked like in a mirror and became agitated. He removed the mirror. If you remove the mirror, he could not see himself. So there's just so much that can be done to make the living situation better for the individuals. safety, security, aging in place. One of the things that I thought was wonderful is to help families create, what is this? There's different stages in going through this process: apathy, reduction in smiling, hugging. And if you look at so many individuals that have Down syndrome, their personalities start to change as they get older, and would be more flat and appear depressed and a lack of pleasure. Sometimes it could be seizures. But what I loved is how to treat individuals and getting to right care and having great programs and the right type of housing that will allow them to live a life as long as they can live a life that is in as much peace and as much harmony as possibilities. They have sleep problems, they have undetected pain, they can be mental health problems, sensory problems. But I don't want to paint this as just super, super depressing, because if you do it properly, it can be done with compassion, with care, and to make, there is a group, as I mentioned, in Southern California called NOAA. And I'm going to stop sharing my screen for just a second. And this group is called NOAA, and they're in Southern California, and they have 2 homes that are serving 15 people in each of their homes. I like a model of people living in smaller homes than large homes, but you know what? God bless them for doing what they feel, and they could get funded as far as doing it. But outside of each of the apartments for the individuals with developmental disabilities, Down syndrome, or IDD, they had a memory book outside built into sort of a little cove before you went into the home, that place. And it showed pictures of the individual before they started really going through the decline. And as I said, it can take from 1 to 5 years, but how you take pictures of the individuals and what they've enjoyed and who they are and have been, and create that picture of that you can continue to look at. So there's some amazing things that can be done in the care, in the honoring of the folks that are a part of it. But most importantly, to get this recognized as an issue that needs to be looked at in the state of California, because to my knowledge, there is just NOAA homes in Southern California, and there's not any specialized housing that is specifically for this population. And that's what we are advocating for, is to do some pilots about creating these homes and really getting individuals and family members knowledgeable about what they can do before they get to different stages and what needs to be done. So the issue is big. What can be done, I think, is huge, but most importantly, it's recognizing that this is an issue to start with and how to get families knowledgeable. I mean, even before we get to the housing, to do workshops for family members, because they are starting to see this and not knowing where to go with it. So I'm just going to open it up for questions. Yeah.
Yeah, let me interrupt you for a second. What can we do as a council to help you out locally here in the Sacramento area or even statewide with TDS?
Well, as I said, we got both David Grady's groups of the San Andreas Regional Center area. The State Council has been involved with this. And I think as time goes on, we wanted to do a pilot to show that it can be done. And it's sort of in the process right now. I think, you know, Sonia, working with you to perhaps continue to partner with the David Grady's out there, and even with Aaron, to be able to show that this is a need. I totally understand the need this year has been around COVID, and so many of the programs have been totally focused on COVID. And before it was homelessness. So we're sort of in the back of it. But Stephen, I think there will come a time, we're trying to walk this through. If we would get some funding from the state to be able to create a house and create a pilot. I've worked really well on creating pilots. So I like a pilot to be able to do it. And then from a pilot, then we can take it out. So I think working with Sonia and perhaps Patty, and thank you for the opportunity of doing this. We turned in our research or our project last, I guess it was April, May, right when the pandemic was starting to really hit us. So I don't think it's gotten much traction. I would work to know that there are some groups in the state, and I've got a consultant that we've worked with that I think is very knowledgeable, that would like to create a support group for family members. So we're just in the beginning stages of all of this, but Stephen, I think it's connecting the dots and first letting people know this is an issue. And I think it's an issue for caregivers. I think it's a huge issue for parents. I've got at least 10 parents that have said they need help. Out of the 1,000 that have said they need help, they don't know how to take care of their loved ones. And remember, so many of them are living with the family members that are also aging family members. So I think support letters as time goes on. I don't know if there's much that can be done right at this moment, just because of, in San Andreas area, and I don't know about Sonia, you could certainly speak to it. We had 12 of our homes out of our 49 homes had COVID. So that was a huge issue that we've been dealing with. There are 30 homes in the San Andreas area right now that have COVID on top of our 12 homes. So quite frankly, I don't want to create more of a stir right now because I know their focus is really getting through this pandemic. But Stephen, I would come back to you in the next 6 months, 9 months, and say, okay, now it's time to focus on this particular issue. Because I know you have families that are in your community that have children with Down syndrome, and also that are clients of your regional center. What is being done? Are there support groups for them? What can be done? I just don't want people to misdiagnose behavior challenges and have medication or all of that. I'll give you one story. I was in New York, and there's a group called YAI, and they are one of the largest providers of support in the greater New York City area. They also are very involved in doing some programs where they're the START program. If you've heard about the START program, I don't know, have you guys heard about the START program? They are a catalyst, or DDS has brought them into at least the San Andreas area right now, East Bay area, they're in Southern California, around behaviors. And I have support for how to deal with significant behavior challenges in homes and individuals. So they are the amazing group of people. So I went and visited them, and I went out, rode on the subway into the Queens area. I went into one of their group homes, and I went with this gentleman named Tom Buckley, who is probably one of the experts of the experts, Dr. Tom Buckley. And he is working in identifying in group homes people that have dementia or Alzheimer's, or at least need to be screened for it, where that wasn't being done. So they were thinking that the people in the group home did not want to participate and were being cranky and behavior issues or throwing things or not wanting to go to their programs. literally is the diagnosis of dementia that was there and how they needed to be educated of the group homes of what to do and those referrals and diet wise and all of this. So, you know, it's big issues. So Stephen, I don't know the answer to that question other than knowing about it. If you know individuals that have Down syndrome, you know, I've got at least a core team here that could be put together. And Sonia, I think talking with David Grady, and who is your representative up in the San Francisco area? Your state council person?
Sheridan Nicolau.
Sheridan wrote a letter and was supportive of us as well. But I think right now, I know the system is entangled, but it will a year from now. I hopefully will be able to do more. But I hope you take away from this that there are many individuals that are out there, and I want to help and make sure that they are as get as much of the services that they need, the families get the support that they need, and we treat people with dignity and care and respect, and we create those opportunities so they live as passionate and compassionate of a life as possible for all. So that's sort of my vision of all of this. And it's not an easy one to talk about because it's a terrible disease. And for anybody, and I have girlfriends that are going through this right now that do not have IDD, and this is a tough disease. This is a tough disease. But on top of it, having intellectual developmental disabilities makes it even tougher. So what can we do to support? So that's all I can say, Stephen.
Well, yeah.
Christina.
If I might say something real quick regarding the START programs, we do have one that's come online here in Sacramento. Actually, the company that I work for, they've created or come online with a START program. So
fabulous.
So good news, they're up here now.
Fabulous. And I'll tell you what, after visiting them and seeing their leadership, I am so impressed. My little nonprofit, we just created a home, and it will be for people that have some significant behavior challenges, and START YAI will be the service provider there, and they're phenomenal. They're just a phenomenal organization. So I'm glad to hear that.
Awesome.
Christine, this has been an excellent overview for us.
Oh,
and I
good.
think a bunch of us have,
It's like one of those, it's like, where do you even begin to tell the story of this? But most of all, just know there's an issue there and there's work to be done. And hopefully to educate the parents, the regional centers, the service providers on what can be done. And I do have one individual that is extremely knowledgeable about this, that has worked on our task group. And then we do have a representative, Paula Gann, as I said, who is on the governor's task group, and it's led by Maria Shriver. And I was lucky enough to go to one of the meetings with Maria Shriver and listen to what is going on in the state of California. So just to be a part of it is wonderful.
excellent, excellent. Well, I think a bunch of us have documented some stuff on the chat line here of how we can try to get information from Alta
Say
Regional,
something, Patty?
and then also turn around and write letters of support
Okay, hold on just a second.
to the Board of Supervisors here in Sacramento.
Patty Pacheco has a question she wants to ask. Let me,
Sure.
tell me, Patty. Wait, say again if you forget your. Just a sec. I think she's asking if she can remember her address and her phone number and her brother's information, that she doesn't have Alzheimer's.
I think she's good.
You're good. Kris McCann is saying you're good.
You're good. You're good. And
She
if you
said,
think,
thank you, Kris, she said.
oh, you're welcome. Which is always interesting.
I
is
think we
that-
all think we have it.
I know. And if you think you have it, you probably don't have it. It's those that don't think they have it that may have the challenges. But, what I can do is pass along to you, to Patty. I'll send you the information that I sent to the regional center with some of the letters of support that we did about what the
Excellent.
need is. And with some of our research and all of this and what the need is. Again, I'm very cognizant of the outstanding issues that are out there in the community. So it is, and I do think there needs to be a group, and I will follow up also with one of the women that we were working with who is, she's a dynamo. I've worked with her for years, and her daughter, Cindy, is experiencing this right now. And she's just such an advocate for people knowing what needs to be done and who you should be talking to and all of that. Maybe between your group up there and our group, we can at least get a core team. I'm just the housing person. That's all. I mean, not just the housing person, but that's where my focus is housing. But I also was a special ed phys ed teacher. And so my heart is into the total person and making sure there's programs that are out there. So, we'll keep in touch. We'll keep in touch, and hopefully, but just know there's an issue, and it's an important issue to be discussing out there.
I'd like to bring it forward to our Board of Supervisors as well. If we can gather information, put a letter together. I know there's other important issues, but this is important as well.
It is an important
show
issue.
the need,
And maybe I can even get Paula Gann, who is has done, again, she's on the governor's appointed by, she's the representative from families with children with IDD to the state of California. She's on the task group, and I need to follow up with her. Her daughter lives at the same housing complex that we helped to create a number of years ago in supported living. But the supported living agency doesn't know what to be doing with her. So that's the problem, is that there's already individuals out there and nobody knows what are the best things to be doing to be able to support. So the issue's big.
Sonia, I really want to thank you for recording this. No, really, I mean, this whole hour, I think, has been quite informative for professionals like myself and even families. Thank you.
Patty, you want to make a motion on a letter so we just have it in the record?
Sure. I make a motion that the council gather data on the issue of individuals with intellectual and developmental disabilities and Alzheimer's, and write a letter to the Board of Supervisors outlining the need. I don't know what the need, housing. Something like that.
Also, you need to create awareness and also homes that could provide the proper.
Yes. I mean, I think it'd be awesome if this would be regional centers, we need training, right? People, the families need training, and the day program support staff, SLS, ILS, people need to know about this. And I think it's important, Kris, when we talked before this a couple of weeks ago about that, doing things before the onset, and making sure that we're aware of it, and how do we work with folks to help them adjust to as it gets worse and worse, and when they have it, and and how you adjust to that. So and it's like doing something in the beginning and not waiting till there's issues, like you said about behavior issues. Well, why are they acting out? Well, there's a reason for that. Let's not just pop a medicine in their mouth. Let's
Absolutely.
figure out what the
Absolutely.
issue is, and maybe this is something medical going on. So.
We did also, I will connect you, Patty, to the individual that has done some training for our regional center with families and caregivers coming in. So at least you can begin getting your regional center perhaps to bring in some training to at least bring this up as an issue, because it hasn't been done in your area, I don't think.
And Maureen, I'll second the motion.
Okay. Good.
All right, guys, anything else at this point?
Chris, thank you very much.
All
sharing
right,
your
thanks, everybody.
Right.
Thank you
Chris,
very
thanks.
much, Chris.
Bye-bye. Meeting's over. I'll let you go and I'll talk to you later and see how you're doing.
She went away. She closed the meeting.
Oh, okay,
Well, she
Well,
didn't close the meeting because we're still here.
yeah.
It's still being recorded.
Patty, I think I sent you an email. Can you